Hey everyone, welcome to my TED Talk. My name is Scott Craig, coming to you in the role of an advanced practice registered nurse in a nursing executive position. And our topic today for our TED Talk is when technology helps some patients and leaves others behind. When we think about healthcare technology, we usually think about progress. We think about telehealth visits, patient portals, remote monitoring devices, and things like that, smartphone apps. These things allow patients to manage their health anywhere. And these innovations have changed the way that we also deliver healthcare and have created opportunities that in the past would have seemed impossible, not just a few years ago. And the research has supported these benefits. Garber and colleagues found that telehealth has expanded access to care and has also created new opportunities for advanced practice registered nurses to deliver services in ways that were previously impossible. At the same time, studies have shown that not every patient is able to benefit equally from these advancements. But today I want to challenge us to think about a different question. What happens when the very technology designed to improve healthcare becomes the barrier to receiving it? So I would like to share a short story with you. Let's say imagine we have a 68-year-old patient with diabetes and hypertension. She's discharged from the hospital and she's instructed to schedule a telehealth follow-up visit, monitor her glucose at home, and communicate with her doctors using the patient portal. To the healthcare team, this seems like a great plan. Everything is convenient, efficient, and available from home. But there are some problems that we didn't know about. One is she doesn't have reliable internet access. She also struggles to navigate the patient portal. English is not her first language, and she shares her cell phone with another family member. So what seemed like a simple plan quickly becomes overwhelming for her. She ends up missing her follow-up appointment. She can't upload her readings. She's not able to see the messages from the treatment team. Eventually, her condition worsens again, and she ends up back in the emergency department. So as far as we know, the technology worked exactly as it's designed. But in this case, the system is what failed the patient. So, although this patient is fictional, I've taken care of many patients who have faced similar challenges. And, I've seen how something as simple as asking a patient to check a portal or join a virtual appointment can become a huge obstacle when they don't have the resources or the confidence to use the technology. So it just helps us to understand that in addition to our getting them in the clinic door or in the hospital door, we also have to get them through the digital door at this point. So that story is just to highlight our central message today, which is healthcare technology has tremendous potential to improve patient care, but if we're not careful, it can also widen existing health disparities. So the first lesson that I learned is that healthcare technology can improve outcomes, but only for patients who can access and use it. Uh, so there's no question that technology has transformed healthcare. Telehealth has allowed patients to see their doctors without traveling long distances. Remote monitoring devices, can track things like your blood pressure, your glucose, heart rhythms, and provide that information in real time. And patient portals, they allow patients to see their lab results, maybe see their diagnostic results, right away, which can also help them make better decisions. So for many people, these tools improve convenience, increase engagement, and they also support better outcomes eventually. However, access to technology is not distributed equally. So the research has shown that patients with lower levels of digital literacy tend to use video telehealth services less efficiently and effectively. Those patients, some patients may have smartphones, and but not necessarily understand how to download an app or navigate a patient portal. And there are others that do have those skills, but they don't have reliable internet or enough data on their plans to participate in a video visit. Cheng and the colleagues found that patients with lower e-health literacy were significantly less likely to participate successfully in a telehealth visit. And this tells us that access is no longer just about making healthcare available, but the patients also need the skills and resources to use digital healthcare effectively. And for some others, the challenge is financial. A reliable smartphone or internet connection, a tablet, some wearable devices. They just may be unaffordable for our patients. Some patients live in rural communities where broadband access is limited, and having a video visit is difficult, if possible at all. So as healthcare organizations continue to invest in technology, we have to remember that innovation, which improves access, is only helpful when patients are able to access it. The second lesson I learned is that digital health barriers are really health equity barriers. When we hear the term digital divide, it's easy to think that the problem is simply technology, but it's not, unfortunately. The digital divide reflects broader issues related to income, education, language, disability, and geography at times. And this is exactly what Yoon and colleagues found when they examined patient portal use among adults with chronic conditions. Their study showed that patients with lower health literacy continue to use patient portals at a significantly lesser rate than others. Even during the pandemic, when portal use had gone up for most people. And so when we think about an older adult who's never used a patient portal, or we think about a patient who speaks limited English and doesn't and receives their instructions through an application, and those instructions are only in English. And then we think about someone who's living in a rural area where broadband internet service is unreliable. We also think about the patient who can't afford a smartphone or computer. And then we realize that these are not technology problems, but these are equity problems. So rather than viewing these challenges as technology issues alone, we should recognize them as barriers that can directly affect health outcomes. And digital access at this point has become another social determinant of health effectively, that influences whether patients receive timely, good care. A patient who cannot access the portal, may miss lab results. They may not be able to complete a telehealth visit and then delay their care altogether. A patient that can't understand the digital instructions, may struggle to manage their illness. So, and not to mention patients with visual impairments and hearing impairments or cognitive issues, they may also struggle if the technology is not designed with accessible features. And the result is that patients who are already vulnerable become even more vulnerable. And that leads us to our last and most important lesson. And that is that advanced practice nurses are uniquely positioned to bridge this gap. As advanced practice nurses, we sit at the intersection of clinical care, patient education, leadership, and advocacy. So we have the opportunity to identify barriers that others may not see. And we're also in a position to develop solutions to help meet those patients' needs. One way we can do this is through assessment, which is a hallmark of nursing. Just as we assess blood pressure or pain or, medication compliance, we can also assess digital access at this point. Does the patient have internet access? Do they have a smartphone? Do they know how to use the patient portal? Uh, do they need language support? Is English not their first language? These kind of questions can help us reveal and identify barriers that, might otherwise go unnoticed. As APRNs, we can also provide education and coaching. Sometimes the patient doesn't need a new device. They may just need someone to help them understand the device that's already in place, to sit with them and maybe show them the steps how that device might work. We can also act as advocates, in the healthcare system to provide multilingual platforms, make sure that our instructions are simple enough, and then for those patients that can't participate in a digital format or digital healthcare, we want to be able to provide them with alternatives. So we can also support by reaching out in the community. So programs that help improve digital literacy. So and we can also advocate for policies that expand broadband access in these communities or underserved communities. So another way we can take action is by coordinating care with caseworkers, social workers, community organizations, IT, information teams, technology teams to help patients receive those resources they need to successfully engage with digital healthcare. And maybe the most important way we can take action is that we can remind the organizations, the healthcare organizations that we may be a part of, that technology should support patients and not replace human connection. Technology should never become a reason that a patient cannot receive care. Our role extends beyond teaching patients how to use technology. We have to also be advocates for the healthcare systems to ensure that they're designed with equity in mind from the very beginning. As I reflect on this issue, I believe that healthcare could be at a crossroads. The future undoubtedly is going to be more digital. AI, artificial intelligence, remote monitoring, virtual visits, mobile apps. These things are going to continue to expand, and these innovative technologies have the potential to improve outcomes, reduce costs, and increase access for our patients. But we have to realize that technology alone does not create equity. It's the people that create equity. And the choices we make as healthcare professionals will determine whether technology becomes a bridge or a barrier. As APRNs, we have the opportunity to, and not only that, but the opportunity and the responsibility to ensure that innovation doesn't leave vulnerable populations behind. And I just want to leave you with one final thought. The next time we implement a new healthcare technology, instead of asking, what can this technology do, maybe we should ask a different question. Who might be left out? Because when we begin with that question, we move beyond innovation and toward equity. And that is where meaningful healthcare transformation truly begins. Thanks for your time. Appreciate it.